Can I welcome members, inviters, guests and the public, both here and those watching on the webcast, to today's meeting of the Health Committee. For our main item today, we'll be discussing the impact of the coronavirus COVID-19 on London. We encourage anyone taking part in discussions on social media to use the hashtag Assembly Health and hashtag Coronavirus London. First, we have a few formal business to go through. Can I ask if there are any apologies, please?
Yes, Chair. Apologies have been received from the Deputy Chairman, Assembly Member O'Connell.
Good. Thank you. Can I ask members to note the list of offices set out in item number 2 of the agenda, and also ask if members have any interest to declare? Good. Noted. Can I ask the committee to confirm the minutes of the meeting of the committee held on the 10th of October?
22nd of January, my apologies.
What?
22nd of January, my apologies. Should be 22nd of January.
Of the meetings held on the 22nd of January 2020, to be signed by me as a correct record. Thank you. Can I ask the committee to note the outstanding and closed actions arising from its previous meetings and additional correspondence received? Thank you. Well, this brings us to the main item today, when we were questioning our invited guests on coronavirus and the impact on London. I also want to say that I know we only have 1 hour with you. There's an urgent medical meeting called by the Chief Medical Officer, which I know all you have to attend, and we understand that. But so that means that we need to be succinct in our questioning here. I also would expect you to be succinct and be focused on the replies. And so can I please welcome our guest first, Dr. Ravin Divakar, Regional Medical Director for London, NHS England. Welcome. Professor Paul Plant, Interim Statutory Health Advisor to the Mayor. Dr. Fiona Twycross, the Deputy Mayor for Fire and Resilience. And John Hetherington, Head of London Resilience. So welcome to you. So the first question I want to ask generally, is that this is a question I often get asked, is how is this different from a flu epidemic? Because I have members of the public and even some of my patients come and ask and say, look, this is all hype. We get a flu epidemic every year. Why should we be worried about this more than the flu epidemic?
Do you want me to lead on that one? So it's a good question, and it comes up. So it's a coronavirus, which is different, and our worry about a coronavirus is it could mutate, and it's novel. So if it's novel, we don't know at the early stage of any incident of its impact. So what we did do very early, and this happened nationally, was to use the flu pandemic framework as a way of thinking this through, but to be very clear that it is a different disease entity. So can I just explain how we're framing this to help you through this, because I think it will help keep the replies succinct. So the international evidence, which is unfolding, and we're in touch with WHO on a sort of regular basis, and our national scientists would suggest that it could well take a similar profile to a major epidemic. And what you're experiencing at the moment is the potential early stages of what we would describe as sustained community transmission. So, but as we speak today, as of 9 o'clock yesterday, there were 91 confirmed cases in London. So that's the situation. What you're experiencing through the media and particularly through the Chief Medical Officer is giving you an accurate picture of the current relative risk to the population, which I think is at the heart of your question, which is how risky is it for which groups, and in terms of the health of them and their families. And at the same time, which is really causing the confusion, people reacting to the international situation and thinking through what would happen if we did start to get very significant numbers of cases in London and elsewhere. So I think we need to be really clear that as we sit here, and as of yesterday, there were only 91 cases out of the population of London. So the advice we're giving on a daily basis is based on the current situation. Okay, thinking through to the future. And that advice is based on that epidemiology, it's based on behavioural science, it's based on the international evidence of we know what works, but that advice could well be changing through time. Okay, so just to be very clear, today the risk is low, but what we're preparing for and making sure the population is aware of what they can do to make sure the risk remains low, and what we want them to do and to keep safe, and how we can help them, and we're thinking through that future. So the whole system has looked at the flu pandemic framework. It's been revised for the coronavirus because we don't have a vaccine, and on a daily basis we're offering professional advice. We have, and colleagues will talk through the wider resilience response to this, but in terms of just be very clear what PHE's role, we're part of a tripartite agreement with National Department of Health and the Chief Medical Officer, and we might get into that.
Professor, I understand all that, but I'm still not clear, right, why I should be more worried about catching this virus than getting the influenza virus. What are the consequences? Is it the outcomes are worse? Is it because people are going to be more fatalities? Why should I be worried about this virus more than the flu virus?
There's two dimensions to impact. There's numbers, the absolute numbers, and for any given at-risk group, the seriousness of the health consequences.
So is the fatality rate higher with this virus than with the influenza virus?
What we know at the moment is that it could potentially be higher. Okay. So our understanding at the moment is a case fatality of potentially up to 1%.
But of course it's age related. That if you're in your 70s it goes up, and if you're in your 80s it goes up too.
Yeah, so the at-risk groups are elderly frail, those with particular respiratory conditions, and who are immunocompromised for either medication or other reasons.
You want to come in?
I just want to ask a quick question. You said 91 confirmed cases. Presumably they're the ones that have been formally tested. But I've been watching the news, and there seems to be some concern that people who may have been in contact with others are not being tested. Are you confident we've got an adequate testing regime happening at the moment?
So yes, but what we're doing on a daily basis is we prioritise the nature of how we follow up and how rigorous we follow up individual cases. So we are absolutely following up those most clinically at risk, their families most at risk, those in a healthcare setting, because of the potential impact on the resilience and having a medical response in some of our hospitals. So yes, but we are prioritising.
Okay. The other thing, Professor Block, how is this virus transmitted? I mean, transmission is a very important aspect of what we do know about this virus. How has it been transmitted compared to, say, the influenza virus?
Well, the basic mechanisms are the same.
Mm-hmm.
So, yeah. I mean, you wanted a succinct answer, and that's why all of the advice is based on transmission in the way, like you say.
I mean, can I get it by being in the room with someone?
Sorry?
Can I get it by just simply being in the room with someone, or does this person have to sneeze upon me for me to get it?
You'd have to be within 2 meters of somebody, and our advice is to prolong contact of 15 minutes or over in that environment increases your risk significantly. So if any of the Assembly members have coronavirus now, I am safe.
Okay.
From a sufficient distance.
And is there a time lag between being exposed to the person who has the coronavirus and getting the symptoms yourselves?
Yes. So it's a number of days between exposure and symptoms materialising, and we think people are at their most infectious to other people if they do have coronavirus after 2 to 4 days after displaying their first symptoms. But that science is evolving because we've got such a small number of cases. I know it seems large, but in epidemiological terms, that we're looking at that on a regular basis, and we'll revise guidance on the basis of what we know as it unfolds.
Okay. Did you want to come?
Yes, please. Could you tell me, we know that the outbreak's particularly bad in Italy. How are we following that pattern of outbreak?
Yeah, so internationally, it's not just Italy. We're following it in the Middle East, the Far East, and we've been following it. We have international systems of surveillance, and we're part of an international system. So on a daily basis, PHE has updates from all of the countries across the world.
So is it likely, therefore, that the measures that are being adopted in Italy will be adopted here as well?
I'm not sure about probability of likelihood. So we keep coming back to how I introduced this, is that we're the Chief Medical Officer is the advisor to government, and government will make that call. What I'm aware of is we're looking at the international evidence base from other epidemics about mitigation impacts, when they need to be put in place, what triggers them, socio-economic impacts, and the length of time they would need to be put in place.
Perhaps to cut this short, if the spread of the virus follows what's happened in Italy, would we have to do the same things that Italy does, or do we have a different view about, for example, the lockdown that they've got at the moment?
That was being debated yesterday at SAGE, which is the scientific advisory group of government yesterday, and I understand COBRA's meeting today to look at those issues. It depends at what point were they further on in their epidemic curve, and therefore the relative risk. It's always context specific. It has wider socio-economic impact, and our concern would be the timing of a intervention as well as when you do it. But yes, to be brief, some of those measures, but not all of those measures, we may take.
Why not? Why not all?
Because some of them don't have international evidence base behind them.
Okay, so some of what you think Italy's done has been done without evidence or insufficient evidence.
Well, what our scientists are doing is translating the international evidence into the English and UK case. Their scientists may have thought that the situation in Italy is different.
If we're going to do some of those measures anyway, and it looks highly likely that the virus will spread much more than it is at the moment in the UK, I don't know if it's a certainty, but it seems pretty likely to me. Why are we not taking those measures to contain the virus now, rather than why are we leaving it for such a long time? I mean, if we're going to do it in 3 weeks anyway, wouldn't it be better to do it now?
So the evidence is from other mitigations in other situations is if you put some of those measures in too soon, that actually what it's requiring of the general population and the impact on their daily life is the mitigation doesn't last its effectiveness over time. So if you go too early, the total impact is diminished.
Is that forgive me, but that message doesn't appear to be getting out to some people who are cancelling events.
We're very clear in the advice we're giving when we're asked. People are reacting and taking their own actions as they want. We can only offer the scientific advice, but yes, people are taking actions we wouldn't advise.
Right, so the people's question time that we're holding this evening, in which there will be a lot of people there, that's fine at the moment.
Our advice is people can go about their daily business.
Thank you.
Okay. Of course, Dr. Duvakar, the NHS has to respond to this challenge. Of course, one of the experience we have heard from Italy is, of course, that a lot of people will require admission to hospitals, may need respiratory support also. Hospitals in this country are designed to operate at 85% bed capacity. That's the safe level of operating of hospital beds in this country. But yet, we operate at 94% most of the time. So our beds are already under stress. We are expecting an epidemic of this virulent form of coronavirus. Are we ready for that situation?
So if I just start by saying, I think firstly, what we really, I think the key message for the public is how the public can both help the NHS and how we help each other actually as a community throughout the country and in London in particular. So I think firstly, following really good public health measures like hand washing for 20 seconds, using the right technique is a really important part of the way in which we as a nation and we as a city will help smooth out the spread of this infection in our communities. I think that's the first thing. The second thing is that in the phase of this illness that we're in at the moment, what we're really calling upon people to do who are understandably worried is to use 111 online as their first port of call, where we have all the guidance that's required. And it's really important to go online and use the 111 online service where there's a really clear set of guidance that will take you through a series of steps if you're concerned about your symptoms or concerned about a member of your family as to what you need to do. If 111 online then advises you to call 111 online, then 111 online will then guide you as to whether you need to be tested. And what the NHS has done in London is we now have 12 community services that are delivering services in order to make sure that people can be tested for it. We've got 19 so-called drive-through services where people can self-drive and attend a drive-in centre where there'll be swabs. That's our preferred way of working because it's a good way of testing people and protecting people. For those who aren't able to drive, we have 12 home teams who can go and do testing at home. And then for primary care and for hospitals, we're encouraging public to use the service responsibly. So, for example, we know that the 111 service has seen an unprecedented rise in the number of people with common coughs and colds and self-limiting symptoms who are understandably concerned. But there is a huge amount of advice available on the NHS website and through 111 online to help people guide through that. And that enables us to protect the core NHS services for those who are most at risk of serious illness and who need us the most. In terms of planning for hospitals, I think the first thing I'd be reassuring is that we plan for surge and for things being busy every winter, and we also look at our plans for flu, epidemics and pandemics every year and keep them regularly updated. We know how to plan not just for normal winter busyness, but also plan so that we make best use of our resources. And really our kind of underlying principle is that those who are the illest and those who need medical care the most urgent, we prioritise on the basis of urgent medical need. And our main focus in terms of planning at the moment is to make sure all NHS hospitals are set up in order to be able to manage the expected increase in demand that we're expecting to see during the time frame that we'll be advised by Public Health England that we can reasonably expect to see.
Well, look, you give me a very long answer, but you haven't answered the question I asked. So you talked about delaying the curve, pushing the curve forward, and I accept all that we should be doing that, washing our hands for 20 seconds, we should be keeping self-isolation, we should be doing all these measures. But all that is doing, right, is pushing the curve, and the curve is going to rise. The point I was asking you is that we are already working at 94% capacity in the hospital beds. You obviously will cancel your routine operations, and I can understand it. But despite that, right, we're a system which is already operating 94%, expecting an increase in number of people who need hospitalization. What are you doing to do that? What are you doing to increase the hospital beds, right, available to us? Or can you increase the beds?
So whenever we are, as I say, whenever our main priority is making sure that we treat patients in order of clinical priority. And so within the resources that we've so let me just revise how I've said that. So within the resources that we have, our first priority is to make sure that we prioritise those resources towards the sickest patients.
Well, today is a budget day. The Chancellor can increase your resources.
Sorry,
I said today's budget, right? Are you asking for more resources?
So Negotiations, as I say, at national level about NHS resources are ongoing. The government's given us a very clear reassurance that if the NHS and other public services needs resources, they will be made available for coronavirus. I think our main focus at the moment is on making sure that we are well prepared and that we have proper systems and processes to prioritise the most urgent patients, that we can look after them in the right settings, and that we have the right staff available based on our best knowledge about what's likely to happen.
Can we hear about China building a hospital within 2 weeks, right? Can we increase bed numbers in this country?
So what we are expecting, and the advice that's been given to us by Public Health England and that was published as part of the government's national plan, is to remember that NHS staff, as well as the general public, are also likely to be unwell. And so what we have to remember is that the limiting factor may not be in building loads of new hospitals, it's in the availability of staff. And so our focus is on how we deliver care in a way that means that if we're expecting people to be off sick in the NHS, that we're well staffed with the NHS to keep delivering care in a safe way.
Okay, well, let me, you bring your attention to the number of personnel. Of course, we know in London we have a 25,000 vacancy rate, a high vacancy rate. I was hoping that you might say to me we could increase the beds by building hospital beds, but you hit the nail on the head, that we can't increase the number of people in the healthcare system, and we already have a big shortage of them. On top of that, of course, the emphasis in all this is in primary care and community care. And GPs, the month of March is a very, very busy time for GPs. They're trying to chase the points, the cough points, the points which turn into practice income. And nowadays, nurses up and down the practices are calling their respiratory patients, asthma patients, calling the people with chronic renal disease, calling people with heart disease to do their routine checks so they can check the points. And those are the very people who are at risk of getting the coronavirus. Do you think the government should be suspending the cough requirements for general practice as we prepare for a war footing for this infection?
So decisions about that are national policy decisions. New guidance for general practices and primary care were issued on Friday, and there's a regular update that goes out to general practitioners. Indeed, the latest one went out yesterday. I know that nationally they're very aware of the arguments that have been put forward by professional bodies and frontline GPs about this, and it's something that they'll keep actively under review.
Okay, because one of the other things, of course, which I talk this as a frontline GP, is that people ring up 111 and they're often told, go and see your GP, this is just a flu infection. Okay, I mean, a lot of workload has been increasing in general practice. And I think that I need to put it on the record that general practice is struggling anyway, but with this extra burden of work and raising anxiety, the system is even more under stress. And we are sending our frontline soldiers with their arms tied behind their backs if we don't do something about this. Okay, did you want to come in?
If I can. Just to clarify then, you talked about drive-through testing, which is one of the questions I was going to ask. But presumably, just anyone who's feeling unwell just can't turn up and form a queue. They're going to have to be referred. So we're not going to be seeing the general population who are feeling unwell being tested. It is going to be a priority system. Yeah.
So,
just step back about what we know about this. If we go through the normal epidemic curve, we're in the mainly contained phase. So we're doing absolutely everything we can, mobilising all of the resources we can. We're in business continuity to make sure we're focused on this, to be in containment. So in containment, you do a lot of testing and follow, as you asked the previous question, you follow people to contain. The likelihood is if the government calls we're going into delay, and in probably between a week and 2 weeks' time, that if we get into that, we get to a position where we don't test. Actually, the two stages you go through is you go to a clinical assessment rather than a test, a swab and a test. So the issue about the pods, testing disappear. And it's a clinical assessment of risk.
Yep.
And the other bit I think we're going to get back to, because I think some underlying conversations we're having here is about how are we collectively organised and how are we prioritising the work so London is safe, dealing with this strategically, mobilising the right resources. So on the resource question, my organisation will work on the basis of we're doing the right thing and we're going to ask the resource question second.
Fine. Yep.
So I think to be into the detail now, I think will be useful to get into what next for the city, and actually to explore a bit of the wider aspect of how as a city are we mobilising
they're going to be my next questions.
Okay, yeah.
But I think that's helpful, because I think a lot of what I'm hearing on social media is people say they can't get tests, but they shouldn't really expect to get tests unless they are prioritised. That's what you're saying. So people shouldn't worry that the system is not working if they are not being referred to a test.
No, exactly. So I think they shouldn't worry. If they need a test, they will have access to one. And what the system is, that if you're concerned that you may have coronavirus, go to NHS 111 online and go through the structured questions. If required, you'll then be put through to NHS 111. We have a national system now through which, if you require a swab, you will then be advised as to where you go in order to have that swab taken. An individual clinician will take that swab, and then nationally ambulance services are then running the system that is then responsible for getting the result of the swab and then calling you back and giving you your result and then advising you what you and those that you've been in contact with need to do. So it's a very clear system, and people, if they're concerned about coronavirus, go to 111 online first, and it will guide you through the process.
Thank you, that's helpful. My then question is for Fiona, if I can. We understand that the government has a strategic plan to tackle this at a national level, but could you just briefly tell us about whether London has a strategic plan and what the Mayor's involvement is in that?
So if I can just run through some of the resilience structures just to put the framework in context. So I mean, we're clear that London's understandably concerned about the outbreak of coronavirus and what it means for them and their family. We do think we're relatively well equipped to deal with the situation, not just because we have sort of leading world experts in health and world leading hospitals, but because we are making sure everything is in place that it can be from a resilience perspective, both in terms of frameworks but also in terms of how we're monitoring the situation and how we're liaising with the relevant organisations. So as Deputy Mayor for Fire and Resilience and Chair of the London Resilience Forum, it's my job on behalf of the Mayor, who's the formal Chair of the London Resilience Forum, to ensure that all the organisations that sit within the London Resilience Partnership are working closely together and sharing information to ensure that we're giving Londoners the best possible advice as quickly and as early as possible, and to make sure that any issues that arise are dealt with as effectively on a cross-partnership basis. And I think it's that sort of joint working that is key. We're in constant contact with experts at Public Health England, and that's both from an officer level on my own part and actually right through to the Mayor. And as the Chair of the committee noted, the Mayor is meeting the Chief Medical Officer later this morning. The London Resilience Partnership has developed a specific COVID-19 response framework, which is based on the pandemic flu framework, which sort of structures the planning for the situation. We've now set up a strategic coordination group to provide an oversight of the system-wide impacts upon London. And we're looking at it as system-wide rather than simply the health issues, because we've identified that actually what's happening at the moment presents challenges not just within the health context, but actually potential economic and social impacts as well, which Paul Plant has alluded to earlier. The Strategic Coordination Group is chaired principally by John Bowerdale of the City of London, but we've actually been building resilience into our own resilience structures. So myself, Eleanor Kelly, Chief Executive of the London Borough of Southwark, and Deputy Assistant Commissioner Lawrence Taylor of the MPS are co-chairs just to build in a bit of resilience into the structure. The Mayor convened a Mayor's Advisory Group of senior officials from Public Health England, the NHS, the Met, London Fire Brigade, the LAS, Transport for London, and representatives from London's local authorities to make sure that London is prepared for an increase of cases in our city. And we've also had internal mechanisms here at the GLA, as have other functional bodies, to make sure that that's all running as smoothly and as effectively as possible, so that we link up all the communication streams. And I think that, like others, I'd just reinforce the need for us to follow expert advice. So any messaging going out from here is based on PHE messages around thoroughly and regularly washing hands with soap and hot water, because actually it's really important that we do follow the expert advice and that we make decisions based on expert advice as we go through the situation as the situation evolves.
I think that's really reassuring, and that actually means something to us here, but I think the general public, talk about structures is actually quite difficult to understand. It's about externally facing, so you have government communications, got public health communications, you have the Mayor. What is the joining up all these messages, and actually the need to pump out a lot of information, because if there's a vacuum, spurious rumours can take place. Is there a plan around that, really firm communications?
Yeah, no, absolutely. And I think that we work on the basis of a single point of truth principle within the work of the London Resilience Partnership. So we would regard that to be the Public Health England lines. So where you see the Mayor communicating through his Twitter feed or in media interviews, that has been reinforcing and reiterating Public Health England lines. Within the structures, and I apologise for sort of talking about structures, but I think it helps sort of set the context. We have a number of subgroups that sit under the Strategic Coordination Group. One of those is a communications subgroup, and that has relevant professional comms leads from across the partnership, so involving sort of the different parts of the system to make sure that those lines are consistent. So that sits underneath the Strategic Coordination Group, but basically makes sure that everybody is singing from the same hymn sheet, if you like.
Can I just specifically on that?
Can I just ask one more?
Yeah.
Okay. If this develops and we get many cases, presumably national government is a prime focus. In that case, what then is the role of the Mayor in this building? Does it change?
Do you mean in the context of London?
Yeah.
Well, I think the Mayor's clearly a spokesperson for London. I think his role remains as the formal chair of the London Resilience Forum. The Strategic Coordination Group is effectively, because it's system-wide, it's got independent, all the chairs are there on behalf of the LRF reporting into the Mayor. I think he's got the convening role, so he convened his Mayor's Advisory Group. He's got an advocacy role, and in terms of actually sort of engaging with the national structures. So, for example, the meeting with the Chief Medical Officer, he'll be asking, effectively, the questions he asks will be on behalf of London, and asking questions about sort of information flows and so forth.
Okay. And can I ask, at the stage when, if we get to the stage of there's a concern about the public transport or policing, for example, will he be making those decisions?
Any decision that's made will be in line with national guidance coming through the health authorities. So there'll be no decisions that's taken that don't take into advice expert advice.
Okay, thank you.
Can I just sort of follow up on that? So daily I advise the GLA and the GLA family on the current situation and the current science. So we have advised on London-specific issues because every area of the country is different. So in effect, that's my role as the Statutory Health Advisor, and we're doing that today and yesterday on an hourly basis, but we're doing it very regularly. So his public pronouncements on a daily basis are based on science on the current situation in London.
Can I just ask specifically on those pronouncements? Who was it that advised the Mayor to say there is no risk in using the tube or buses or other forms of public transport or going to a concert?
That will be national guidance based on the latest information from Public Health England.
From Public Health England?
Yeah. We're using the Public Health England information.
Do you think the Mayor might take an opportunity to revise that? I find it incredible that he says there's no risk to...
I think we need to...
Sorry?
I'm not sure about the precise language, I haven't got that in front of me, but if this was last week, as of last Friday, there were only 26 cases in London, and therefore the scientific advice for me would have been that Londoners should go about their daily business, and that the list was...
Say that.
I would never say no. I would be advising that it was extremely low, and on that basis there was no action that TfL or others would need to take at that point in time. And the earlier
I get
when I
that.
introduce this is that may change.
I get that. I understand that. We don't want to create panic. We don't want to say don't use the tube. We don't want to say don't use buses. But to say that there is no risk surely can't be right. And that statement probably needs to be addressed by the Mayor to say, of course there is a risk, no matter how small, of getting that on the tube.
I don't have the specifics in front of me, but I think it probably would have been said in conjunction with the messages about hand washing and sort of
Sure.
that sort of side of thing.
Sure,
but the situation is evolving on a daily basis. So any lines that or any communications from the Mayor would be based on the advice we were getting on
Well, this
that
is my
particular
concern
day.
because people
Yeah.
will trust what the Mayor says
Yeah.
to be the current medical advice, and the medical advice saying there is no risk appears to me bizarre.
When was this from, by the way?
It was on Good Morning Britain, and it would have been something like Monday, last Monday.
So it is. I mean, things have changed.
Oh, they've changed,
Yes.
Yeah.
but no risk.
Really.
You know.
Sorry, have you finished?
Yes.
You wish.
Chair. Fiona, you've given us very helpfully an overview of the structures, but if I could ask you, and John, you might wish to come in, although bearing in mind the time, we only have 20 minutes left, can I ask you some questions about the impact on specific sectors? So let's start off with transport services. And again, I make the point, one doesn't wish to be alarmist, but just to look at various scenarios and look to the future. What impacts are envisaged on London's public transport network if workers start getting ill in large numbers? And are there any plans to alter TfL services as the outbreak becomes more severe? And generally, what is TfL doing? Well, I think, I was going to ask what is TfL doing to prevent the spread of the disease on public transport, but I think that question has already been answered. So specifically impacts if workers start getting ill in large numbers, and any plans to alter TfL services?
All the functional bodies have been asked to look at their business continuity plans, to look at what the impacts might be. I mean, if organisations start getting impacted, then like all other organisations in the whole city, then quite clearly some people would suffer from the illness from Transport for London, as with every single other organisation in the city. So those are being updated on an ongoing basis, as are the GLA business continuity plans.
That's helpful reassuring Londoners. So just moving on, we've seen stories of panic buying in other countries, and in fact, rumours that are really happening in London. What are you doing to work with the major grocers to regulate supplies of food?
I think we've already seen welcome action from the major supermarket chains to limit the sale of some in-demand items. From the GLA perspective, I've got a meeting coming up later this week with I've been in contact with the chair of the London Food Board. So we would expect her to be, she chaired the subgroup in relation to Brexit, and some of the work relation to Brexit will help with this, because it's similar sort of supply issues. However, what we would say is there's no evidence that there should be any need for panic buying, because there isn't currently a supply issue. So I think that what I'd like to say is that there is no evidence that it is necessary for people to stockpile, but we welcome what the supermarkets have done independently to make sure that supplies are preserved so that everybody can get access to what they need.
Can you give us an example of what they've done? Because from the accounts I've heard, personal accounts, in East London, actually a lot of supermarket shelves are actually empty when it comes to basic supplies like toilet rolls and so on.
I think that they've been, so the supermarkets are limiting people to buying no more than 5 of certain goods. That would include toilet rolls. I think they probably limited them more, dry pasta and so forth. They do restock regularly, so I think that hopefully we'll start seeing a slowing down in people panic buying. I think that the Director of Food and Sustainability at the British Retail Consortium, Andrew Opie, has said that supply chains remain robust, and even where there are challenges, they feel that retailers are well versed in providing measures to keep shops running smoothly. But I think their fast action has been really helpful in this respect.
So are you in a position to reassure Londoners that they should not stockpile goods and that supplies will continue to get through despite the virus?
Well, there's no evidence that stockpiling is required or necessary, and obviously it can have an adverse impact on people who aren't able to do that. And one of the things we identified when we were doing the Brexit contingency no plan Brexit contingency work was that actually only those people with a reasonably high level of income could afford to do it. So there's an adverse impact potentially on people on low incomes.
So as things stand at present, stay calm, carry on business as normal.
Yes.
And what about managing the supply of medicines? Are there similar plans in place to manage the supply of
I
medicines?
think that would be a question for the NHS.
Sorry, yeah,
Yeah.
you're right.
Yeah, so there are robust plans for medicine supply. The message that we wrote out to primary care and also I think we'd want to give to the public is not to stockpile medicines. Obviously with any form of stockpiling, if you stockpile, then the impact of that is then it has an impact on the total supply. At the moment, we're confident about the UK stock for medicines. Bizarrely, the preparation that we did for exiting the European Union was extremely helpful in strengthening those even further. And I think we're confident that we have a sufficient supply of medicines that are required for this purpose.
Thank you. And again, moving on, so to look at the police and fire services, and I think you already referred to the fire services in your role as Deputy Mayor, but what impacts are envisaged on police and fire services if the virus becomes widespread?
I think that they would clearly need to enact their business continuity plans. All the functional bodies are assuming that they will have staff absences and are sort of putting plans in place to make sure these are mitigated.
Okay. Have any significant issues around community cohesion come to your attention, Fiona?
I think
Joe talked about spurious rumours. You get my drift where I'm going.
The what, sorry?
Joe talked about spurious rumours circulating on social media. So in terms of community cohesion, has any...
Yeah, I think this is obviously something that's being monitored as well. There is monitoring of hate crimes, and I think that we are concerned to make sure that we continue with a zero tolerance attitude towards hate crime, particularly targeted at particular communities. So we are specifically monitoring any particular hate crime or sort of sentiment around the Chinese community, for example.
Couple more questions, Chair. Again to you, Fiona. Earlier, right at the very beginning of the session, Professor Plant talked about how risky is the virus for some groups. So looking very specifically at, say, vulnerable groups such as the homeless, does the Mayor have a specific plan or will he think about one to better prepare for the spread of the virus?
This is something that I think the Mayor's deeply concerned about. There currently isn't any specific government advice or from the government on coronavirus in relation to protecting people living on the streets, those in assessment services or in hostels. So I think the Mayor has been urging ministers to engage with the charity sector to make sure that official guidance is produced as a matter of urgency. In the meantime, the Mayor's team is in close contact with services that are commissioned by the Mayor and the GLA, boroughs and charity partners to ensure vulnerable rough sleepers in London receive proper support in dealing with the coronavirus.
Thank you. And a very final question to you, Professor Plant, and you may wish to come in, Dr. Divakar. The use of face masks. So I've read on articles on the web that they're actually largely ineffective, but people stockpiling face masks, and basically what's happening is that services that do need face masks, infected patients in hospitals, frontline staff, they're not able to access the numbers required because face masks is got to be sort of worn properly, changed regularly, and certainly, as I said, the articles I've read, limited as my medical knowledge is, all seem to make the point that actually, A, they're not effective, and B, that by stockpiling or you're actually depriving people and services that actually really do need them.
The scientific evidence is they're not effective, and therefore as a population health measure, we don't recommend them.
Yes, and I think there are sufficient supply of all protective equipment for NHS staff performing their roles. And we've issued very clear health protection advice to all NHS settings about the type of protective equipment that they should be using depending upon the particular type of clinical care or procedure that they're offering, and that includes primary care.
Thank you. We'll come to the end.
Yeah.
That means we'll give you the key question. Don't worry.
Oh, right.
Okay. I suppose people are being self-isolate themselves with their risk of infection. But people who are particularly homeless, right? Where can they go for 14 days to self-isolate themselves if they're homeless?
This is a question that we've been asking guidance for from government. It is clearly an issue.
Okay.
So and I think that it's also something that's come up through the Resilience Partnership in terms of making sure that we're on top of what's happening for particular vulnerable groups. So that's something that we're really keen to follow government guidance, but we need government to give that guidance in order for us to follow it. I don't think it's particularly helpful if regions or areas make up their own advice. We need to follow expert advice, but we do need government to provide that guidance.
Good. Before we come to the key question for the morning, just one thing I want to ask you, Dr. Divakar, is the Chief Medical Officer, Professor Whitty, said to the House of Commons Health Committee that NHS could flex to deal with the peak of the outbreak and would look quite different from what it is now. He used the word would look quite different. I wonder what this would look like in practice for London when we do need to flex our muscles.
So as I was saying some moments ago, I think the NHS is set up to always prioritise on the basis of clinical need. And so when, as usually happens in the winter, and as we might expect as part of an epidemic, we have a larger number of acutely unwell patients, we would prioritise our resources accordingly to make sure that those patients that need their care to be delivered most urgently get their care in a timely way. In terms of delivery of care, however, we will and we are advising both primary care and hospitals to look, for example, at the way in which they deliver care, so where it is clinically safe to do so, and indeed often may be more convenient for both patient and for staff to use, for example, telephone consultations and video consultations in order to do so.
But you know, only 1% of consultations in this country, in the UK, are on video at the moment. Only 1%. 99% of consultations are not on the video. How do you think we're going to flex up on video consultations in the next 6 weeks?
So if I speak from my own personal perspective, so I'm a consultant paediatrician. I look after children regularly and do a regular outpatient clinic with them. For those patients, what I'm really clear about is that I have a proportion of those patients who I can safely and in fact probably as effective, it would be more convenient for them if I looked after them by telephone, where I don't need to see the patient in order to discuss their symptoms with them or in order to make an assessment. Clearly there'll be other patients where we must bring them up to the hospital and where we have to see them in order to weigh them, measure them, do tests and so on and so forth. So actually the role of video consultations, I think, is limited to a relatively small number of areas where we want to monitor patients by actually seeing them, but where for whatever reason they can't travel to a health facility, and that's where our main area of focus would be. So we want to use the right communication method for the right...
So it really means an increase in the number of telephone consultations in reality.
So I think as this progresses, we're likely to see more consultations offered by telephone where it's clinically safe to do so and it's the right thing for the patient.
Great, thank you. Andrew.
Just to follow on that, do you therefore see more people signing up to things like Babylon, which I know I've signed up to, which is mostly video and audio consultations?
Yeah. So even prior to the onset and the appearance of coronavirus worldwide, the NHS in its long-term plan that was published last year had made a commitment to move to a different way of delivering both outpatient services and also delivering primary care services using telephone and using online methods. The particular organisation that you mentioned is a private provider of primary care services, so it's not part of the NHS. And in fact, all general practitioners over the course of the next few years will be providing and patients will have access both to online and to telephone consultations, and many of them are providing that already.
Don't pay for it. Anyway,
well, there's a whole debate about that provider, and I don't want to unstabilise NHS practices do the hard work. But anyway, that's a different debate. The question I think is important to say that video equipment will be provided to the NHS over the years.
It's going to come. The question I did want to ask is, of course, we've got the elections coming up in May, and I wondered who the mayor has consulted with regarding those elections and whether or not there's a chance that they may have to be suspended as a result of the virus.
I think I know the Chief Officer's been talking to the MHCLG about this, as of present, we have not been given any indication that they're going to be postponed, but obviously we're expecting a number of measures to be announced by government over the next few weeks potentially.
Are there plans in place just in case they are?
I think this is part of the continuity planning that Mary Harpley as Chief Officer has been carrying out with senior members of staff.
Right. And who because obviously this is not just a London issue, it's
no, absolutely.
It's all over England.
I don't have details. What I can do is ask the Chief Officer to provide you with a briefing on what conversations she has been having and what plans they would have in place if it were to be the case that the government, and this would be a government decision based on medical advice and expert advice, but this has formed part of her continuity planning, as I understand.
That would be helpful to get that kind of guidance from thank you.
Well, can I thank all of you? we still have 3 minutes left, but can I thank all of you for your contributions this morning, for taking the time to come here. Can I ask the committee to note the report and subsequent discussion, and delegate authority to the chair in consultation with the deputy chair to agree any outputs? Yeah. Can I ask the committee to note the update of the work programme?
Noted.
Thank you. This is the last Health Committee meeting of the Assembly year. The London Assembly's annual meeting, due to take place on the 15th of May 2020, will decide which committees to establish in the next Assembly year and a timetable of the meetings, unless the government chooses to suspend the elections. So there are no other items of urgent business. I therefore close the meeting. Thank you.
GLA